All right, let's rock and roll. What I have for you this morning is issued by the National Council on Aging. This is the 2025 National Falls Prevention Action Plan, okay? And what I'm gonna do is read to you the points that they outline that are of importance to quell and assist seniors and falls. So we want to reduce the number of falls. That's what this is targeted at. And let me read you a little bit about the National Council on Aging, give you a little background information. So the National Council on Aging, or NCOA is their acronym, is the national voice for every person's right to age well. Working with thousands of national and local partners, we provide resources, tools, best practices, and advocacy to ensure every person can age with health and financial security. Founded in 1950, we are the oldest national organization focused on older adults. Now, the Center for Healthy Aging supports the expansion and sustainability of evidence-based health promotion programs in the community and online through collaborations with national, state, and community partners to help older adults live healthier lives. And Emeritus Health, guys, we are a partner with the Healthy Living Initiative from the National Council on Aging. And so I get emails from you all the time. They have little toolkits and really helpful resources that I can refer to. And what they do is just lay out a guideline throughout the course of a year and give you ideas and tips as a provider to talk about points to touch on that they seem relevant to our senior community. So good stuff. Now, flipping over, we're looking at our summary. What are they trying to accomplish here? Falls have become the most frequent fatal injury in the United States for people older than 65. And I know there's no one here older than 65, but I'm going to go ahead and go forward. Other serious falls land hundreds of thousands more older people in the emergency departments or hospital beds, costing an estimated $80 billion annually, mostly paid by Medicare and Medicaid. You've heard me say that number. The last number that I came across originally was from 2016, and it was $50 billion. 10,000 Americans turn 65 every day. That trend is going to continue into the 2030s, well into the 2030s. I did not see another published number until 2024. And that was January or February, and that number was between 80 and $100 billion now currently are attributed to fall-related injuries, and Medicare and Medicaid bore 2/3 of those costs. Think about 10,000 Americans turning 65 every day. I was just speaking with a student in class here about the shortage of nurses and doctors and healthcare workers because we just don't have enough people. So that's going to be an issue that's going to have to be solved. You know, we want everyone to be able to age healthy, but falls are not a natural part of aging, and that's the gap I'm in, right? I'm one of those community partners looking to get partnered with National Council on Aging. That's why we do that. Now, they recognize both the scope of the challenge and the opportunity ahead. The NCOA and its National Falls Prevention Resource Center, with support from the Federal Administration for Community Living, has prepared these 2025 National Falls Prevention Action Plan. Okay, there's 6 points. We're going to cruise through here, and then we're going to get rocking and rolling. So the plan sets out 6 goals and priorities. Number 1, expand public awareness, messaging, and advocacy. I don't know too many older adults that I work with that aren't paying attention to falls and their safety and trying to avoid falls. Most of us, I would even go out and say all of us over the age of 65 have either fallen or we know someone that has fallen. Most of us have known someone that has had a significant fall. In other words, broken a bone, ended up in a hospital, something of that nature. So bringing awareness, I think everyone's pretty aware. Maybe awareness to the different programs available. Broaden funding across sectors. Number 3, scale evidence-based and proven interventions. That would be like Balance University, taking Balance University international or across the country in this instance. Number 4, drive more clinical and community partnerships. Number 5, generate new technologies and expand access to existing technologies. Things like using Wi-Fi as a sonar, that exists. I just got an article from a student here in class today that's talking about new technology and the use of AI in that technology to help protect seniors and keep seniors safe. Lastly, number 6, improve data. So by improving data, it'll give us a clearer picture on what's working and what's not working when it comes to interventions. So this is, guys, the 2025 National Falls Prevention Action Plan. Take a look at it. I'll post it on the website in the references and sources section. Click on that. Go check it out at mybalanceuniversity.com. You guys know I always post our sources on that website. You can check it out for yourself, okay? With that being said, let's stand, let's go behind our chair, let's get rocking and rolling.